welcome to the Otter Tail County Veterans Show. I'd like to thank Park Region Telephone Otter Tail Telecom for the opportunity to talk current affairs regarding veterans, benefits, their survivor benefits, dependent benefits. I'm Charlie Campa, Otter Tail County Veterans Service Officer, fortunate to have two offices in this large county. Our office in New York Mills is at 118 North Main Street and open Monday through Friday, 8 to 4:30, completely staffed with a very knowledgeable staff in Sherry Frizonki, the Assistant Veteran Service Officer, and Elizabeth Lang, our administrative professional. The number is 218-385-5540. Here in Fergus Falls, the office is located just south of the historic courthouse at 505 South Court Street. Laura Nelson, the Assistant Veteran Service Officer, and Heather Osey, the Administrative Specialist, 218-998-8605. Introduction of myself and the offices. And today, a very special guest in from Sharon Notch is UCare Medicare Marketing and Sales Rep for Northwest Minnesota. Thank you for joining us to talk about some changes coming up in Medicare cost plans. But first, tell me about yourself. You say you've been with UCare for quite some time.
Hi, Charlie. Yes, I thank you for letting me be here today. I really appreciate it. It's a great opportunity to help educate people on what the changes are and what's going to be happening. I actually work for a health plan. I live over in Todd County, little bitty Eagle Bend, but I've worked with UCare about 7.5 years and have done the marketing, but also the Medicare basic sessions in the area. We just held one here yesterday, actually, to teach people about what is Medicare and the different products and plans and when to sign up, that type of thing. But I worked as an advocate for many years for Senior Linkage Line back in the day for about 8 years in Todd, Wadena, and Morrison counties. And then I worked for the Disability Linkage Line as a coordinator for 4 years. So have kind of been around the block a bit with understanding some of the Medicare changes, and just very grateful to be here.
How was the turnout yesterday?
We actually had about 14-15 people yesterday, which this time of the year is actually a good number. Usually in September things are really slow, but with all the news and hype that's out there, people are getting a lot more anxious and wanting to get information. So we did have a really good turnout considering the month that we held this meeting. So
I'd like to add to that too. I will be returning to doing town halls. Last year I did a total of 12 town halls in various town communities around the county, and I find too the same, that harvest time, early fall when everyone is being productive, the turnout is a little bit smaller. So those will be coming up around the county later this fall and into winter. Today we are going to learn about Medicare changes. And Sharon, do you think there will be a few veterans and spouses that are going to be affected by what's coming down the line? First, please, the difference between a cost and an advantage plan.
Well, I think one thing I maybe will mention is that there are Medicare plan changes coming for 2019. And what is happening is that effective January 1st, 2019, federal law is stating that Medicare cost plans sold in Minnesota in 66 of the 87 counties are going to need to end. So what that means is there's about 370,000 cost plan members in Minnesota. And out of those members, about 315,000 are going to lose their coverage. Now, that's huge. This is a big deal for Minnesotans. It's a big deal for us in rural Minnesota too. These products have been very, very popular. In Otter Tail County alone, there's about 8,000 cost plan members that are losing their coverage. Individuals that are enrolled in a Medicare Advantage plan are not impacted. These are specifically cost plans. So to get back to your question on what is a supplement, what is an advantage plan type thing, is that kind of your question you were asking? What happens is these particular cost plans that are out there are great health insurance products for people on Medicare, but there's also Medicare supplements, which is a different type of product a person can buy, and that product is, you carry that along with your Medicare coverage. So you have Medicare as primary, and then you have your supplement, which supplements Medicare, which means it fills the gaps to Medicare, because Medicare doesn't cover everything. And then a person would buy Part D drug coverage separate. Now, for many veterans, They may have their coverage through the VA, so they may not feel the need to have the Part D benefit. That's simply a choice. But a supplement does not include Medicare Part D drug coverage. So that's the one option that people have. And then another option people have are Medicare Advantage plans, which is a different type of an insurance product that takes the Medicare benefits and the drug benefit and rolls it all into one package called Part C. The cost plans are a different type of Medicare health plan, which is very confusing to say the least. And explaining that in great detail, I'm not going to do that. But what I will say, Charlie, is that a lot of people think that their cost plan is a supplement. Because anytime we enroll in insurance as a Medicare recipient, we often just use the term supplement because that's what's been around for so long, the name, the terminology. So we really do encourage people to make sure they know what type of product they're in and look at their ID card. And does it say Medicare cost plan on it? Or does it say supplement? That type of thing.
I've talked with one veteran's widowed as recently as yesterday who is receiving advance notice about these changes.
Yes.
And after October 1st, more information is going to be coming down the pike in the form of mailings, as I understand, explaining the process, the differences, but what does this mean to someone who has a cost plan?
What this means for individuals that are currently enrolled in these cost plans is, number one, they've already received letters from their company that has this particular product, letting them know to please calm down, everything will be okay, we'll send you information, be on the lookout for further details. They should be receiving some letters towards the end of this month that will let them know what else they may be offering these consumers. So these Medicare beneficiaries that are currently enrolled in the companies that sell cost plans will get a letter that will tell them what's happening, to be patient. The new information will be coming out effective 10/1, October 1st for 2019 plans. See what product we can offer you. Those cost plan companies may come up with a Medicare supplement for an individual to go into, or a Medicare Advantage plan, Part C plan, that person could go into. As well as there'll be tons of other plans that will be available from other companies to compare against, but they are getting letters from their companies letting them know what may be available to them from that particular company.
I was Navy for 4 years. I think I've mentioned it a couple of times on the show. Very proud of my service, but my senior chief, Mike McGinnis, used to say quite frequently in our operations, planning and preparation, Charlie. Planning and preparation. So how does someone prepare for major changes like that?
Oh, okay. The first thing I would say, because everybody's kind of anxious right now, is number one, take your time. Slow down, take your time, really understand what kind of products are going to be out there for you and compare. A couple things that we want to look at is, number one, what can you afford? What is your budget? What are your premiums going to be for these plans that are out there that you're looking at? Does it include Medicare Part D? The prescription drug coverage, and do you need that? You know, what's important to you? What features? What benefits? There's some individuals that really want dental, some want eyewear benefit, hearing aid benefits, some that travel quite extensively that want some of those worldwide coverage or snowbird coverage. It depends upon where you doctor. Medicare Advantage plans have networks of providers, although quite broad. They have networks. You want to make sure your doctors are in the network. If you look at a Medicare supplement, Medicare supplements supplement Medicare. So if you want some of those added benefits, do you need to find that elsewhere, or what does that particular supplement offer you?
Did I read correctly that there's a possibility that you might Medicare might eliminate the 3-day rule for hospital stay and then going into a long-term care facility?
I have not heard that yet, Charlie. If you have that news, I haven't heard, but it could be. I've traveled a lot, so I don't listen to the news as often as I need to. But I know currently original Medicare says that there's a prior hospitalization stay needed as an inpatient for the nursing home. That will be something that an individual will want to ask as well when they're comparing plans. We often don't think we're going to end up in a nursing home, but easily it could happen if we fall and need some rehabilitation therapy. So just ask those questions when you're comparing. Think of all the questions that you do have, write them down, and then go to meetings, go to informational meetings, request information from the plans that you're interested in. Talk to your agent. There's thousands of trusted insurance brokers and agents that are available for people to have them look at all sorts of different options available to them. The Medicare.gov website is extremely helpful. The local senior linkage line, Minnesota SHIP, or state health insurance program, is available. So we really just want people to ask questions, look at what they need, what's going to fit for them, our doctors in the network, what added features do they need.
Timelines, there's quite a few that seniors should be aware of, beginning October 1st.
Beginning October 1st with the timelines, the new information will be released from all the insurance companies that are out there for Medicare recipients. And trust me, they're getting letters in the mail already letting people know about dates of meetings and that type of thing. Open enrollment starts October 15th. And that typically runs through December 7th. For most people that are enrolled in Medicare already that want to make a change, they have till December 7th. For these 300,000+ cost plan enrollees, they have a special enrollment period. They're actually going to get a longer window of time to be able to make a change for January 1st.
With no change to
With
their
no
coverage.
penalties, no issues, no pre-existing condition type features. They actually will have guaranteed issue rights. So it is kind of an open door for those individuals to, number one, again, take your time, really evaluate what you're going to need, what's going to fit best for you. We always have our friends that say, oh, I do this and it fits me perfectly, I love this plan, but we're all unique, we all have different needs, so please make sure you look at that as an individual.
Advantages of Medicare Advantage Plan, Health Club, Dental, Annual Physical, Eye Exam, you've covered all of these already. The changes are significant. It's just going to take time for seniors to wade through all of the information and attend meetings.
Attend meetings
Get a chance.
or go online. We have a lot of internet savvy people that are out there nowadays that really would prefer to just do some of the research themselves online, and by all means do that. Narrow down the options of who you even want to look at. Again, it's going to be, I know it doesn't sound like it, but it is going to be simple in the fact that there's going to be Medicare supplements where you buy Part D separate drug coverage, one choice. Or you enroll in a Medicare Advantage plan that includes Part D if it's needed for you and adds some of those other extra little features. Are there co-payments? Is there a network? What are the co-pays? What is the network compared to the supplement? How is that covering me when I travel? Does it have any extra things like dental or fitness? Those are the questions you're going to ask of each of the products that you compare.
I might make note that TRICARE for retirees or those who are on TRICARE through Veterans Disability Benefits is as credible as Part D coverage, and the VA prescription formulary is as extensive and as credible as Part D coverage. So it's something else for veterans and dependents to take into consideration as you make a choice on, if you're on a cost plan, make a choice on switching to a different policy. Features to consider when choosing Medicare Advantage expertise, local versus national insurer, Minnesota-based customer service, quality ratings, provider and pharmacy networks. It's all there.
That's going to be really important because Medicare Advantage plans and Medicare Part D drug plans, as well as Medicare cost plans, are all rated by the federal government and members every year, and providers. They get a star rating every year. That will be important to look at what is the quality rating of that particular product. On top of that, remember, the cost plans are only ending in 66 of the 87 counties. So there's still some bordering counties around here that are going to be able to keep that product for the next year, like Traverse County. I always think Wheaton. I think of Wheaton. That's not that far from here. That particular county is keeping it. Stevens County is keeping it. There's a few, and it's listed on the Minnesota Department of Commerce website. The counties that are able to maintain those products for the rest of for next year and for I don't know how long. But that definitely is still a choice for some individuals.
Can you comment to the reasoning for 66 out of the 87 counties?
Yeah, it's a little bit of a complicated piece of it, but one of the main reasons is if there's 2 or more competing Medicare Advantage plans sold in counties based on population, that's one of the main reasons that they're going away. The other reason is basically the federal government, but it's a federal law. There's cost plans throughout other parts of the United States, but by far Minnesota has a huge percentage of cost plan enrollees nationwide.
Okay.
So,
to recap then, from the top, take it from the top. How to prepare, know your product, know your insurer, talk to a broker.
Talk to a broker. We live in rural Minnesota. I do too. And you build relationships with those local agents and people that you have worked with for years. And they're good people, and they know how to look at Medicare.gov as well and do comparisons for you. They will help you look at this is the supplements that are out there. Here's some of the prices. This is the drug plan that would go with this. Here are the Advantage plans. This is what this offers for you. Does that seem to fit your needs? What's your max out of pocket, that type of thing. So yes, take your time. I'm glad you mentioned the formularies, the drug lists, because for people that are on a lot of medications or insulin-dependent diabetics, those with inhalers, it really is important that you find plans that cover your drugs well for you too. Sometimes that is actually a priority for people, more so than whether they have a copay for the doctor. And I also am glad that you brought up TRICARE. I actually had a couple people just ask me that this week. If they're on TRICARE, do they need to buy this other expensive insurance policy? And I'm like, talk to your veteran service officer. Typically when you have TRICARE and you have your Medicare, you're good.
Yes.
You don't need to look at anything else. I mean, because of how they interact and who pays for this and who pays for that. I said, you've got really, really great insurance. And just to make sure people don't over-insure either, that can happen sometimes too.
I had 2 retirees' spouses, wives in office yesterday. TRICARE is now sending out cards too, announcing the fact that you can make changes to your TRICARE policy. That's all it said on the notice, with the exception of TRICARE is now going to be offering dental coverage. And that is going to be
That's
the
going to be
change.
wonderful.
You don't have to change your TRICARE policy if you're comfortable with it. In fact, I don't believe there are many changes to be made to a recipient who is in receipt of TRICARE. So the Civilian Health and Medical Program, CHAMP VA, is the acronym for those veterans whose disability benefits allow their dependents to be on insurance through the Veterans Administration, CHAMP VA. That too is as credible as a supplement to Medicare Part A and B. I've heard tell that these changes started in 2015, and the legislation has taken this long to get through the system, and now it just kind of came up all of a sudden. And if I were a senior, yeah, I'd be a little spooked by what's coming down the pike. Everyone needs insurance, and nobody really likes changes when it's can affect your life and your livelihood. But there are affordable Medicare plans out there.
There are, Charlie, and there are, the companies that have the cost plans, with all respect, aren't going away. The plan that is being sold is going away.
Okay.
And plans can change every year. That's very common. Once people are on Medicare, things can change, things can be tweaked a little bit, and that's just common business, is you look and see what's working well for people and what can you do to improve that product and meet the needs of the consumers. So again, we really just encourage people to take their time, figure out what they can afford, the budget, everything, the network, max out of pocket, that is there a stopping point for them. Reach out for help. We at UCare are willing to help people too, as you know, just like everyone else, but UCare is right in Minnesota, and they can call us at our 877 number 2. They can go online at ucare.org and meet with us, and you can do that with most of the companies that are out there. But Charlie, also in regards to veterans, one thing I want to make sure, we also encourage people at our Medicare meetings, if they are a veteran and they haven't talked to their veteran service officer or never talked to a veteran service officer and did have some time in active duty and that type of thing, to please at least have that conversation. It doesn't mean necessarily that they're going to qualify for anything, but they should at least have that conversation with their veteran service officer to see if they potentially can qualify for any benefits or programs.
Every county in Minnesota has a veteran service officer or more, and administrative staff some, and they work full or part-time. Yes, thank you for the plug, Sharon. I really appreciate it, because it's without fail. Many times people come in and, I've never talked to a veteran service officer before, and especially those approaching retirement age, and want to know what's available through the Veterans Administration versus Medicare Part A and B. And yes, we will encourage you to subscribe to Medicare Part B when you reach retirement age. Many individuals, and I can use the word many individuals, feel that the Veterans Administration is as credible as the insurance provided by Medicare Part B. A is a given, B you have to purchase through your Social Security. That's not the case. Veterans Administration healthcare is not an insurance. It's healthcare for veterans, and there are ways that VA will help pay, especially now, Sharon. The VA it is eliminating what they call the choice program. Many people are familiar with that program, where the VA will outsource veterans health care to a private facility and then pay it through the VA. It's been the big thing since the time when the news arose that all veterans weren't being served in a timely fashion. So if you have questions about your veterans benefits, certainly see our offices in New York Mills or Fergus Falls. Walk-ins are welcome, appointments are preferred, so in advance we can take care of what your specific needs are, be they compensation benefits, pension benefits, education, vocational rehabilitation for disabled veterans. I did not know much about my VA benefits at all until I took this position some 13 years ago. Anything else you'd like to add about the changes?
I cannot say it enough to tell people again, just take your time. Please do not be in a hurry. If you are losing your cost plan, you have an extended window of time to be able to make a decision for January 1st coverage. Just make sure you really understand what you're enrolling in. Make sure you understand if the plan will fit your needs. And again, I can't say that enough. That's so important.
Have you any more get-togethers, meetings coming up?
We have tons of meetings coming up for Otter Tail County, for example, and I'm just speaking on behalf of UCare's meetings. Our Medicare sessions are now done for the year. We hold them through September, typically, of every year, and usually start them up again in February. Senior Linkage Line does hold them throughout the year, I believe, although I think they slow down this time of the year too, because it gets so busy. But we'll be holding informational meetings on our particular products, as well as other companies will too. Ours will be starting here in October. We'll be at the American. And then I also, for Otter Tail County, have Perham at the Community Center. So there's a couple locations we'll be talking about our Medicare Advantage Plan products. But again, make sure you get the literature from the companies that you're interested in. Make sure you go online to medicare.gov and access their Finder tool on that site. Just reach out for the resources to get some assistance.
I don't want to leave without calling attention to our wonderful senior representative here on Otter Tail County. Her name is Nancy Voss. She works at the Government Services Center. There's the Seniors Linkage Line. There's all sorts of resources out there to help as we move forward. And once the fervor subsides a bit, I'm sure everybody will be quite pleased with the policies that they choose.
I do too. There's going to be a lot of good competition out there next year, and a lot of innovative products that will be out there that I think will meet the needs of people no matter what their situation. And even at our Medicare session yesterday, we showed the Medicare.gov website, and most of those individuals didn't realize this site even exists. And it allows you to enter your prescriptions on that site and gives you a summary of the plans that will cover your drugs for the best. And that's something that Senior Linkage Line does for people, all across the state. They'll assist people with at least comparing their drug plans.
Thank you so much for joining me today.
Thank you, Charlie.
Salute to all veterans, dependents, and survivors. I'm Charlie Campa. That's the Otter Tail County Veterans Show.